So my plenary presentation today was an overview and update on the NBIA disorders, including the whole range of now some 9 NBIA disorders, including the 4 more common of these ultra-rare disorders. So NBIA stands for neurodegeneration with brain iron accumulation. It's an overarching term that's used to consider all of the neurodegenerative disorders in which we see iron accumulation in the globus pallidus and substantia nigra. The 4 most common forms of this disorder is PCAN, PLAN, MPAN, and BPAN. So these are all acronyms. They can be found, actually details about each of them can be found at genereviews.com, which is a very good website for looking at expert-authored, peer-reviewed, very current information about neurogenetic disorders, which is the case for each of these. So you can go to genereviews.com and put in PCAN or PLAN or MPAN or BPAN and read about them. These are all neurologic disorders that some have their presentation in childhood, others in adulthood. They're symptomatically treatable to varying degrees, depending on whether there's Parkinsonism, whether there is a trial of chelation or not to try and remove the iron. But the most exciting thing that's happening right now in the NBIA disorders world is the introduction of rational therapeutics that are aimed at trying to correct the primary defect in these disorders, that is to replace the product that's missing in PCAN, gene therapy in PLAN, which is the form that's associated with defects in phospholipase A2, and rational therapeutics for other forms as well. So this is an exciting thing that's going on in this field. There is a clinical trial currently underway for chelation using deferiprone in PCAN. PCAN is the most common form of neurodegeneration with brain iron accumulation, and there's a trial that's been organized through Thomas Klopstock in Munich and Elliot Wyszynski Children's Hospital in Oakland in the US. And if you have patients you're interested in considering enrolling with PCAN, you can contact them to participate. It's unclear whether chelation has a role in the NBIA disorders, whether iron is actually a key part of the pathophysiology, and so this trial is aimed at trying to answer that question specifically in PCAN, but the question remains in the other disorders as well. So it's a very exciting field. There's a lot happening. There are more genes coming over the next few years, but the major genes have been discovered, and now we're moving to interventional trials. It's a very exciting time in this field.